Good afternoon, everyone. Welcome back to another episode of Mind Split Cafe. Of course, we have Matt with us,
What's going on, guys?
and today we have Raquel of Palms Behavioral Health, and she is an LCDC and an LPC, chemical dependency counselor, and a licensed professional counselor. Raquel, how are you doing?
Hi, good afternoon. I'm doing very good, thank you.
You
I
want to
wish
give us like
sometimes I had. I wish sometimes I had an acronym at the end of my name. But obviously, my name is just Matt Palm. Because if I had an acronym, it'd be like LOL. So anyway,
I mean, technically,
thanks.
you have an acronym. You're licensing, right? For
Yeah,
the
thanks for joining the show, Raquel.
Yeah, of course, thank you for having me. And
Awesome.
the acronyms do get kind of long sometimes when you have to sign your name with all those acronyms.
LMNFOP and yeah. So yeah, I get it. I
It's
get
got the alphabet behind her name.
it. Yeah. The alphabet is just in my name. I've got that 9-letter last name, but yours is pretty long too. Ballesteros, right?
I guess that
Raquel Ballesteros, right?
That was
So
good.
yeah, so we know how it is with long last names, right? So um so Raquel, tell us why you're here and why you have the acronyms on the end of your name.
Sure. So, my name, like I said, is Raquel Ballesteros. I work with Palms Behavioral Health. It's a psychiatric hospital in Harlingen, Texas. And I know the Mind Split podcast has been kind of doing partnership with my employer.
Oh
So
yeah.
you've spoken to my director and our director of medical services. So I'm one of the clinicians in the inpatient setting. Our hospital has three major areas: admission and referral, outpatient, which is Peter's area that you all did his interview a few weeks ago, and I work on the inpatient side. So I'm one of the clinicians. I'm in the units with the patients, and my acronyms, MED, Masters of Education and Counseling, an LPC associate, and I should be finishing up my hours hopefully in the next few months. So I'll be a full LPC.
Congratulations.
Thank you. And then LCDC intern as licensed chemical dependency counselor to practice in Texas.
And that's why you're here, right? To talk about substance abuse and
Yes, so that's really my area of interest as a clinician and as a where I hope to grow my career is in substance use and addiction recovery and treatment.
So I know you mentioned that you're part of the inpatient. So do you do outpatient counseling for substance abuse as well, or do you do inpatient like partial hospitalization treatment?
I am solely assigned to the inpatient area of the hospital. I was cross trained in admission, so doing intakes, and then I was also trained in outpatient. So I help cover sometimes, but those are not my primary assignments. My primary assignment is the inpatient care.
Well, why don't you paint a picture for us on how that happens, or how what goes on with an inpatient substance abuse treatment from start to finish? What does that look like?
Well, a patient coming into the hospital for substance use could be there for like a detox protocol. Our hospital does offer detox services in benzodiazepines, alcohol, and opioids. So that would be like a medical detox where they come in for safety, right, to help prevent any kind of medical complications, and they're seen by the psychiatrist. So a lot of our patients are like dually diagnosed, comorbid. Some of them have a primary, what we call chemical dependency diagnosis, and then some are secondary mental health or vice versa. But a patient who's coming in specifically for substance use would be there primarily for detox. While they're in our facility, they safely detox from whatever substance they're on, and they attend group therapies, they attend the programming, just as any other patient would. And then throughout their duration of stay, we try to get them set up with aftercare services, or we try and help set up referrals for outpatient recovery, a recovery treatment center, what people would call rehab, if they're interested in those services.
So you're definitely trying to instill that when they come in, that you want to instill that these people's lives have value, right? Like some people are, down in the dumps, or they're addicted to whatever substance it is, and so they might feel like their life is not valued, right? Or isn't worth it. And speaking of, you're worth it, right? We want to send a shout out to, if you notice, we're wearing hoodies from a up and start fashion clothing line. You're worth it. Jesse Campos, great guy. So anyway, so he's got the you're worth it. So it kind of falls hand in hand with Mind Split and what you guys are doing at Palm. So to show them that they have value, right?
Yes,
Yeah.
definitely. I think there's still a large stigma with addiction in terms of some people see it as like a character flaw, a moral failing, but it's not that, right? Addiction is a true medical disease,
A
and
brain disorder.
mm,
It is absolutely a brain disorder. It's in the DSM-5. People still don't know that.
But it doesn't necessarily have to be a substance, right? It can be an addiction to
oh,
gambling or to sex or to alcohol. I mean, obviously alcohol is a substance, but it could be an addiction to, I don't know, a number of things, right? Masturbation or whatever. Like you can have an addiction to plenty of things other than just, chemicals or substances, right?
yeah, definitely, of course. So there's a lot of like cross addiction. With what we see sometimes in patients is they drop one addiction and then they pick up another. So they say, oh, I'm no longer addicted to, opioids, but now they're addicted to online gaming or
Mm.
something like that. So we see a lot of crossover in like
Do
types
y'all
of.
treat anybody that's addicted to Dr. Pepper? Because if that is, then I'm coming to see you guys.
That's about to be your first one.
That's not.
Yeah, I mean, there's the first one for everything, right? The first time. So
Well,
That's more so an addiction to sugar than the actual Dr. Pepper, I'm sure.
yeah.
So there's like behavioral addictions as well. But our hospital primarily treats chemical dependency addictions.
Okay.
Mhm.
Okay. Now, if
Well,
someone were to come in that didn't kind of fall along the lines of the chemical dependency, could you send out a referral, or do you have, the channels to make sure that that person got treatment or got help for that non-chemical dependency or
Definitely,
addiction?
if a patient, expresses that they have a sexual related addiction, we would definitely refer to um, clinicians and
Somewhere.
doctors that are more competent in those areas.
I guess basically what I was trying to get at is that Palms isn't going to turn away anybody that needs help, right? They're always going to find
they'll
channels.
find a way.
Yes, they're going to find somewhere, within their network, not so much just Palms network, but within their, clinician network or whatever.
Mhm.
They're going to find treatment and help for that person that's seeking it out.
Yeah, definitely.
The last thing I'd want, if I was that person that was seeking help and finally got past my pride to say, hey, I have a problem, I need to go seek out treatment. The last thing I would want is to go and be told, we can't help you, sorry, and just turn me away. And then,
Yeah,
so
no, that definitely won't happen. I'm sure we would help the patient to the best level of our care, and then we would refer them to other specialized practitioners.
now, are you there 7 days a week, or how does that?
Oh
Because
gosh, no, I couldn't do that.
couldn't do it. I was going to
Um,
get into that in a second too, like how.
no, I work 5 days a week, so I'm a Monday through Friday clinician. Mhm.
Okay. And how do you, I mean, if you hear all these stories,
Mhm.
right? How do you, what do you do on those other 2 days or when you're not at work? Like, how do you kind of keep yourself sane and not like, you know, find yourself in the swamp, so to speak?
Well, I sleep. I sleep to recover. Primarily, I make sure I sleep. Um, and I actually, on my time I'm not at work, I'm a student. I'm still continuing my studies.
Are you getting more acronyms then?
Yes, yeah. Next up is MPH. That's a Master's in Public Health. So
Okay.
I'm doing.
Congratulations. That's good.
Thank you. I'm studying public health right now because as a clinician, we do intervention at the individual level, with the patient one-on-one. Public health sees these concerns through a community health approach, a public health approach. So I'm studying public health in terms of like seeing it beyond the scope of the individual and now at the community level, the state level, federal level, on how to address these issues. So when I'm not at work, I am resting or
Or
studying.
Or studying.
and what
Mhm.
school are you going to?
Right now I work, I'm sorry, I'm a student at UT Health, UT Health Science Center in Houston.
Oh, nice. Okay.
Nice.
Congratulations. And when is
Yeah,
your
that's
date?
cool.
When's your expected date of graduation to get more acronyms to your name?
August of 2024.
Awesome. So it's right around the corner.
It's coming
About
up.
another semester, pretty much.
Who
Semester and a
wants?
half, whatever.
Mhm.
Well, congratulations. That's awesome.
Now, I want to backtrack real quick. I know we were talking about some acronyms and things like that in the community level, but I wanted to backtrack and talk a little bit about detox because I know that that's one of the hardest things to actually get through and start.
Mhm.
And there's various ways of going through detox. There's medication assisted detox. There's cold turkey. Um, so, do your patients actually, when they come in for detox, do they meet with Dr. Hernandez for medication assisted treatment as well?
Yes, so our hospital does offer medication assisted treatment, and they can meet with either Dr. Hernandez um, or our other psychiatric providers, and they would put them on protocols to help with the withdrawal symptoms, to help with the cravings, um, to prevent seizures. So it is medication assisted while they're detoxing.
How long does that usually take with the medication assistance? Like to
Um,
get through those withdrawals and that detox?
Usually it's a 5-day protocol, but each patient is, on a case by case basis. Just generally, it's a minimum of a 5-day protocol.
And it's just like a flush, right? Like it's
Mhm.
just a chemical flush of all the toxins and
Right,
remnants of that substance, right?
right.
Ah,
Okay.
that's it's gotta be tough. It's
Yeah.
gotta be tough.
And
So,
it's
what
actually,
else?
oh, I'm
Go
sorry.
ahead. No, go ahead.
It's quite, we see their progression from the day of arrival. Maybe they're still under the influence,
Mm-hmm. Like
still
one last kind of like swig before they go in, and just like they know they're not gonna get it again, and so like
and
one last hoorah.
in the
Yep.
progression of their days that they're inpatient, we see them go from, the heaviest of withdrawal symptoms. I've seen patients just not doing well, shivering in their bed. They can't get out of bed. When I have to meet with patients like that, I try to be more accommodating instead of, usually we try and get the patient to program, leave their room, go to group therapy, make sure they go to the cafeteria. On a detox patient's first or second day, they're not willing or able to leave their bed. We go to them. So I stand at their door, or I do their assessments at the door, and I sit with them because they just can't get out of bed,
Yeah.
and we try to accommodate that. And then
I can
over
imagine
the,
the struggle.
over the progression of days, they're more able to, manage their symptoms and be able to go to the cafeteria, be able to go to group, and then hopefully by the time their body's adjusted, we can talk about rehab options and like make those referrals and
Well,
everything.
you know what I find, what I just met you earlier on the show before the show started, and I can tell that you probably have a great bedside presence, right? Like you just seem so calm and soothing and reassuring, and you know one question I have is, why did you get into what you're doing? Like, what was it when you were growing up as little Raquel that made you want to do exactly what Raquel is doing now? Like, was it an
Um,
event? Was it, somebody in your life? Like, what was it
I
that?
think it's just over time, several different things. I've always known I wanted to help people in some capacity. I just didn't know how to do that.
Mm-hmm.
I thought that was through nursing or through something else, and then I really quickly realized, I can't handle what nurses do. I really can't. So then I started working for it was like a federal volunteer program
Okay.
called AmeriCorps, and they would send us out into high schools to help youth and adolescents transition from high school to college. And
Mm-hmm.
that's when I started learning about mentoring and guiding people through different processes in their life, transitions of life, right? And that's what got me interested in counseling and guidance and
Awesome.
counseling. At first it was more like education based, right? Helping people transition from one school to another,
Mm-hmm.
um, to their profession or employment, things like that. Um, and then once the pandemic hit and I really saw how a lot of people struggled and started relapsing because of the pandemic, I wanted to shift
Yeah.
from educational counseling to clinical counseling. So that's when I started working at the hospital, to do more hospital-based care. And then that's when I started realizing, okay, I see this as a public health issue as well, not only an individual issue. I mean, the pandemic, obviously, it highlighted a lot of public health problems. And so that's when I started leaning more towards substance use and recovery. Mhm.
Yeah, I'm sure during the pandemic there was you know, so much relapse. Like, it was
Oh
so
yeah.
much, and
Yeah,
not
people.
even relapse, but I guess the start of people, like,
Mhm.
like the beginning of a journey of substance abuse because of the isolation that they, you know,
Nothing else to
that we
do.
all felt, so I'm sure that.
It was it was a time with like marked by social isolation. A lot of people were going through grief and loss, family members
Mm-hmm.
that were passing because of the disease,
Mm-hmm.
and it was just it really set the
So
stage.
it was the worst of times, but it was kind of it was good for business for you guys, right? I'm just kidding.
I mean,
Well, the hospital
technically.
never closed, so
Yeah,
I
yeah.
mean, never a day
So
off.
yeah.
So what are some of the risk factors that come along with SUD or substance use disorder?
Well, risk factors of a patient who may fall into substance use. It could be like family dynamics, their upbringing, their environment, if there's access to substances in the community. Here, where we are in the Rio Grande Valley, there is a lot of access, especially because we're on the border.
Oh
Um,
yeah.
People can cross over and get kind of
Whatever
anything.
they want.
Yeah,
Yeah.
exactly, anything
Very easily too.
very easily. So we live in an area where culturally it's maybe more not I don't want to say acceptable, but it's more accessible. And so not just family environment, but also like the community environment, and then individual characteristics like an individual's mental health, their personality traits, their like I said earlier, if a patient has substance use, they may have also a mental health condition like anxiety or depression or something like that. And those two, they're very bidirectional, meaning that when one worsens, the other one might worsen, or when
Yeah.
conditions is affected, so is the other. So um, just a lot of different risk factors. Not only like we were talking about the medical model, not only our predisposition, our genetics, a lot of psychosocial factors as well.
Yeah, absolutely. So you had mentioned that or so let me retract. After detox,
Mhm.
patients off withdrawals, they're now ready for some sort of talk therapy. What is your therapeutic approach? What do you go to?
Well, I I know this probably like um it depends. And I don't like saying that, but it does depend because each person that is going through um addiction, they're at a different stage of recovery, right? So there's people who come in for court mandated detox and they don't want to stop. They just say, I'm here because a
I
judge
have to
told
be.
me I have to. So everybody's at a different stage of change when it comes to recovery. And so as a clinician, I have to assess at what level of change are you so I can accommodate my approach to them, being more supportive or more confrontational or more challenging. Like all of those factors differentiate based on the person's stage of change, their willingness to continue their help. A couple of weeks ago, I had a patient come in for suicide attempt. So he was there primarily for mental health, but he also had a comorbid opioid uh, addiction, right? Opioid
Mm-hmm.
use. And when I asked him the questions about substance use, he was very, honest, very upfront that he uses every single day, whatever he can get his hands on. And I have to assess, at what stage of change are you? Are you ready to start, or are you ready to start working on that, or is it something you've considered? And he straight up told me, no, I am not going to stop using. Once I'm let out of here, I'm gonna go find my
So
next.
he was forced to go in.
He was brought in on a detention for suicide. For
Okay, I see. I see.
5150 hold. So that I have that made me think of a question. When
Mhm.
someone's on, for example, his scenario exactly, he is opiate use disorder, and then he goes in for suicidal ideations, and it has to be held there. So now that guy is not getting his opiates, which I mean, within a couple hours of not getting it, you're going to start going through withdrawals. So what
Right.
happens there?
Well, in that case, patient would be put on the medication-assisted detox,
Mm.
so that he doesn't have seizures or have severe withdrawal symptoms. We don't want to harm the patient, right?
Yeah,
So
of course not.
he would
But
have to put on.
but so he's there on a detention, right? And if the patient's telling you, and we're not talking about this particular patient, but
Mhm.
if that patient is telling you like, hey, when I get out, I'm using again,
Mhm.
what do you, I mean, do you at that point feel like any treatment or anything besides the medical induced detox, right? But any counseling or anything is kind of futile because they
Mhm.
don't really want to hear it.
Yeah, um, I see it more from a harm reduction standpoint. So at this point, I understand the patient um, is not willing to work on abstinence. That's not their goal.
Yeah,
But what we can do is counsel on harm reduction, right? Make sure he understands the necessity of clean needles, a safe place to use, um, be able to find and administer naltrexone for
yeah.
prevent overdose. So there are other things we can talk about
Mm-hmm.
for safer substance use if he continues.
Well, bless your heart.
Mm.
It's sad, but I'm glad that there are people like you, Raquel, that are there
Mm.
to help people that, some people go in there for they want to make a change. They're tired of that life. Some people just don't because they're not exhausted yet from it, and you're there for all of them. So bless you. You're a saint.
Well, thank you. Thank you. Just
You're
trying
a
to do
saint.
my best to help the community and the people.
So
Fantastic.
real quick, and I know we're probably coming up to time, but harm reduction. A lot
Mhm.
of people think that that's like taboo or you're enabling someone to continue to use. What are your thoughts on that? And what would you tell someone that said you're an enabler now?
I would say that it's not an all or nothing approach, and it can't be. Um, back in what was it, 70s and 80s, when the US federal government rolled out the war on drugs, it did kind of dichotomize substance use in terms of all or nothing. People saw it as a terrible thing we have to stop. But addiction it's so complex. It's not just you're abstinent or you use. There's so much gray in the middle, and people are at all stages of change. And so wherever they are, wherever they fall, in whatever level of recovery they are at, we want to preserve life, quality of life, as best we can, which necessitates harm reduction strategies.
Good answer. Yeah, I love that. I think that's 100% true.
Well, Raquel, and all of your acronyms, I'm just kidding. I'm just messing with you. Well, Raquel, you were welcome back to the show anytime you would like. It's been a pleasure to have you on. And I know the patients that get in front of you, they're blessed, because I can already tell that you're there, you're an angel, and you're trying to help them for good, and so I commend you for your work, and if there's anything that Chris and I can ever do, or Mind Split Cafe can ever do for you, then please let us know, because we would love to help you.
Absolutely.
Thank you. Thank you for that extension and invitation. Yeah, thank you for having me.
Oh
yeah, it was a blast. I enjoyed it.
Yeah. Well, tune in next week, guys, for another great episode.
Wait.
If you need to find Raquel for whatever reason, she's at Palms Behavioral in Harlingen. But Raquel, thanks again for joining the show this week.
Thank you.
Matt, we got to do a giveaway. Matt, we got to do a giveaway real quick.
Oh, that's right.
You're Worth It is giving away a hoodie very similar to what Matt and I are wearing. And how you win it is by emailing us the answer to this question at info@mindsplit.org. And we'll put that right here on the screen somewhere. But the question is, what degree is Raquel currently working for? So the first person to email us the correct answer will get a hoodie from You're Worth It. And we'll also put the You're Worth It handle for their Instagram on here as well. So you guys can go visit the page, show them some love, and order some stuff if you don't win the giveaway.
Fantastic. All right, Raquel, don't say anything. You already gave the answer away.
Can't
So
give it up.
don't say anything right now. Okay, go back and watch the show, guys. All right, get a free hoodie. They're really comfortable. Shout out to Jesse again at You're Worth It. Raquel,
Yes,
thank you. You're welcome back anytime. And tune in next week, guys. And we'll see you soon. Take care.
Bye, everyone. Thank you, Raquel.
Thank you.
Like, we weren't supposed to come up with something this clean. Like, something happened.